is really about knowing what you need, being able to communicate what you need. Sally is what is called a poor historian. Hopefully you can see how being like Sally kind of works against you. It's a lot of doctors are not good at teasing out your concerns. Okay, so this is about self-advocacy today. I'm actually very excited to do this because I've wanted to do this for a very long time. I think it's really important, and a lot of us are not particularly good at it, myself included. I guess that's not the best. So let's get going. Okay, this is our agenda. What is self-advocacy? I'm going to talk a little bit about patient rights. I'm going to introduce you to two folks, Sally and Jean. There's 8 steps to advocating for yourself or somebody else. And I just want to touch a little tiny bit on medical gaslighting because it's a term that's popping up in the literature lately. This is me. I didn't introduce myself before because I knew I was going to do it here. Okay, I am by trade a former IT business analyst. And what they do is if a company has a computer system and it's not really doing what they need or they need to upgrade it, I would come in and determine the needs of all the stakeholders, so all the people who use it and touch it and need it. That's many, many departments. So I would gather all the information and I would write it up and make it something that a normal person could understand, or the developers or whoever, right? So I really got good at gathering information and writing it up. And that really kind of prepared me for being president of the Calgary Neuropathy Association. So I use a lot of my skills: listening, information gathering, writing, and technical skills. And I really, as I was growing up, I wanted to be an active person, but because I got diagnosed with Charcot-Marie-Tooth disease, which is a hereditary neuropathy, that was really never in the cards. Never knew why, but I do now. And the reality is, instead, I'm a person who does gentle yoga and can't always even do all of that. But it is what it is, I guess. Okay, about this presentation, I am not a medical practitioner. You probably figured that out. Take what you like with a grain of salt and leave the rest. It's like I said, I'm an information collector and organizer. So I've collected a lot of information for this presentation. So I want you to know, though, you're not expected to do all of this. Like, you don't have to do all of it in order to advocate for yourself. What you need to do is pick and choose what applies to you and your particular situation. We know with brain fog, we can't do it all. And like I said, I'm not a particularly good advocator for myself. I actually used to advocate for my dad when he was still alive, and it was way easier to do it for somebody else. Just saying. Tools. So a little point on tools. I'm going to identify a number of tools throughout the link. There's links, and I've discovered the links won't work when I make it into a PDF for you guys. So in the email where I send out the presentation slides, I'm going to include all the little links in that email. I already have it queued up and ready to go. So you can expect an email shortly after this presentation. Okay, so self-advocacy is really about knowing what you need, being able to communicate what you need, and standing up for yourself. So that's talking about symptoms, that's talking about all your concerns, asking questions, clarifications, asking for clarifications, asking, and alternatives. It's not easy. It sounds easy, but it's not easy. And there's lots of things that work against us, including some of the things we do ourselves. The way healthcare is structured, for example, time is short. We all know that. Staff is under a lot of pressure right now and has been for a long time, of course. And well, some of us people are not as well mannered as we should be, perhaps. It's a lot of stress on the folks, and the system, the way it's structured, isn't ideal for them either. I want you always to remember, though, that you are the expert in your situation, or at least hopefully you're going to be. And that the doctors really want to help. And they know a lot about medicine, but they don't know everything about everything. And they certainly don't necessarily know about you, the details of your system, your symptoms. If you can afford the expensive medications, maybe they're not fully covered. How you're feeling physically or mentally, how it's impacting your life, your ability to actually take care of yourself if you have any help at home. Or if you're one of these folks who has a chronic condition, but you have to take care of somebody else as well. Basically, you need to be prepared to tell them. And that's sort of what we're going to be talking about today. Okay, one of the things that's working against us is that peripheral neuropathy is actually really complex from a medical standpoint. My dad never got that, by the way. He always used to bang his leg and say, they should just be able to fix my darn legs. He never even got what condition he had, but it's very complicated. Okay, so there's many causes, and identify them can be challenging. Anybody with idiopathic neuropathy gets that. There's a variability in symptoms, and that means individualized treatment approaches for each person, right? It's a chronic condition, which means there's ongoing care, long-term treatment strategy. It's just not a one and done. It's progressive, of course, for most. Slowing or stopping the progression can be really challenging, if at all possible. It's not for me, for example. And one little change, like a strong antibiotic, for example, can cause a leap in the progression. Reversible damage is very limited. Some nerves can be reversed, but most can't. So mostly they focus on symptom management, and you can't expect full recovery. That'd be pretty darn rare. Just the nervous system itself is very intricate and complex. I mean, you get the idea. I could say more about the others, but you get the idea that peripheral neuropathy is complex, and that's one of the things that makes it hard for us. So getting started. All right, let's get started. Okay, patient rights. There's something out there called a Patient Bill of Rights, and that is a document outlining the rights and responsibilities of those receiving medical care. I got to say, there's not just one. I'll talk more about that in a couple of slides. But what most Patient Bill of Rights have consistently is to be treated with respect, safety, dignity, a treatment to a certain standard. I don't know if all the standards are the same everywhere, but there are standards. Clear communication. And that can mean having an interpreter is there, or an advocate. I didn't see that in any of the Bill of Rights that I looked at. It's usually more in the policies, but you should be protected there for sure, if that's something that you need. You have the right to be fully informed, access to your medical records. You have the right to make your own decisions, whether you give consent or you refuse. And all of them that I saw, you have a right to make a complaint, and they have a mechanism to do that. Responsibilities. Every patient has responsibilities. There's always with great right. Okay, with rights you have responsibilities anyway. Most of them contain these. You're responsible to give complete and accurate information. Indicate that you understand the course of action to follow. I never really thought about it before, but the doctor always does ask, do you understand? At least mine does. following the treatment plan. How many of us have gone to the physiotherapy, actually, gone to physiotherapy, gotten your little treatment plan exercises, and perhaps did not do nearly as many as they recommended? Well, it's actually your responsibility to try and do that. I can't say that I always do either, but it is usually in a Bill of Rights. Keeping appointments or canceling with appropriate notice. Paying the bills, always. Following a site's policies, rules of conduct. So, and that always includes being respectful of the staff. So it's definitely a two-way street. You have the rights, but you also have those responsibilities. Okay, I can't speak too much to healthcare systems, except that they're all different, right? Or, your local providers, basically. So what you need to do is maybe dig into what your local Bill of Rights would be, the local policies for, say, the hospital or the care center that you're going to, the clinic even. But start with, what do you need out of a healthcare team? And what kind of things are you expecting so that you can compare? A primary care physician, there's 3 levels. The primary care physician is always your first point of contact. And he or she is a gateway to the secondaries, the specialists, and then on to the 3rd level, so acute care and surgery and the ICU. So that primary care physician is your medical team leader or coordinator, if you like. In some respects, I think it's the same everywhere. What they really focus on is your primary care. So dealing with the minor stuff that you might come in with, doing prevention, say vaccines and stuff. Don't anybody get mad. Referrals, and they're the bridge between you and the secondaries. A good GP, by the way, will follow up on all referrals just to make sure they get done. A specific Bill of Rights, policy, info. If you're looking for it, you kind of got to go by province or by state. Now, I did find one for the US, actually. It's americanpatient.org, and they have a patient Bill of Rights that I assume would cover all of the US. It's included in that email that I'll send out. Definitely in Canada, I only found some for a couple of provinces. States often have their own individual one, as will, say, a hospital or a provider group or any kind of healthcare organization. So you can look at those Bill of Rights and make sure that they align with, what you determined your needs are. Hopefully they should be pretty standard, but referrals and how to find the best one in your area. Well, some clinics do allow you to self-refer. I can't think of an example offhand, but I know there are some where you can. The primary care person will often recommend somebody within their network. We have here what's called primary care networks, and so they will stick to those generally, but they won't go outside their system. So they won't recommend a chiropractor or a traditional Chinese medicine or take your pick. So you can seek referrals from your friends or family. If you know they've seen a good practitioner. We have a fella here in Calgary who is a chiropractor, and every time I get calls sometimes from people asking about different clinics and stuff. And there's one chiropractor I always wince when they ask, because I've never heard anything good. So I just tell what I've heard and preface it with that. And I've never had any experience with him. Anyway, even word of mouth references, even if I get them and people say and rave, I will still go to ratemds.com. And I found an excellent podiatrist in town here that way. So it's always good to check and read their reviews if you're into that kind of thing. Okay, I need to take a sec. Okay, Sally and Jean. I want you to meet Sally and Jean. Okay, Sally. This is Sally, and Sally went to the doctor, and she says to her doctor, this tingling and numbness thing I've had for, I don't know, maybe a few years, it's gotten worse. Maybe it isn't that long. I can't really keep track. It's kind of comes and goes, but it's always there. I think it's gotten worse lately. I'm also kind of getting some headaches. I don't know. Oh, and some weird pains too, but I don't remember when those started. My chiropractor said something about nerves, but I'm not sure. It's really been worrying me, and I'm having some trouble sleeping. Can you tell me what her issues are or her priority? Not awesome. This is Jean. Okay, Jean, I've been experiencing persistent tingling and numbness in my hands and feet for the past year, and it's progressively getting worse. In addition, I've been dealing with sharp shooting pains in my extremities, especially in the evenings, which have been going on for about 6 months. My chiropractor mentioned something about peripheral neuropathy, and I'm worried because it's affecting my ability to perform daily tasks, and the burning pains it causes me trouble sleeping. I also have nightly muscle pains in my calves that feel like a tight knot. They wake me up at all hours. Can you tell me more about peripheral neuropathy and what we can do about it? So Sally was not prepared. She really hadn't thought about her issues and doesn't clearly have her priorities set. Jean, on the other hand, was clearly able to communicate what her problems, what her symptoms are like, and what she's worried about. Sally is what is called a poor historian. Hopefully you can see how being like Sally kind of works against you. Okay, a poor historian is a patient who has difficulty providing accurate or complete information about their medical history, their symptoms, and details. It's not a judgment call of a person's character, but you can see how it could have implications to care. Poor communication really makes it difficult for the practitioner to know what it is you're asking, what your issues are, and what's your biggest concern, what's your priority. It requires the practitioner or the doctor to spend a bunch of extra time asking probing questions. And they might not even be the right questions because it's based on the information you gave them, and that might not be that helpful. Incomplete or inaccurate information obviously can hinder the ability to make an accurate diagnosis or recommend the right treatment. And of course, it leads to misunderstandings. This quote on here, communication is the #1 breakdown in the health sector. Not sure this is what they were referring to, but, and it's not just patients, but patients can improve that, and it can start here, right at the beginning, when you're first going to the doctors. Another thing that's working against us is that asking questions is hard, especially if you're not prepared. Sally definitely wasn't prepared, and so she felt really uncomfortable, and she felt like she was on the spot. Simply put, asking good questions or reasonable questions is a skill. It's a lot of doctors are not good at teasing out your concerns. It's a skill, and they don't teach that in medical school. Plus, they've got that arbitrary time limit that puts pressure on them. So, know what your concerns are. Say them up front, or you really could be disappointed in the care that you get or the results. You help them help you better if you have everything together. and it makes sense. Asking questions gives them even more insight to you and allows us to organize our thoughts and thinking around what we don't know. Okay, so what can Sally do to advocate for herself? Okay, 8 steps to advocacy. So organizing, educating yourself, planning ahead for your appointments. At your appointments, there's things you can do. Points 5 through 7 are ones that you might not need, but I added them anyway. So easing your load, standing up for yourself if you need to, and maybe you need to have somebody come with you to advocate for you. And then there's a final one that's about follow-up. Some of this may seem over the top, but of course it could be all simplified for your particular case. Okay, let's start at the beginning. Number 1, organize. Start a binder to keep and find everything. And just so you know, I'm not making it up. I do have a binder. I don't know if you can see that, but I do have a binder. It's got all my papers in here, and the front section, that list at the front, is really just me writing down each appointment and what happened at it. So it's chronological is how mine is, but it could be by condition if you have many conditions. It could be by clinics that you attend. You might want to include who you have as an advocate. Something you can put in there. And I also wanted to add in here, you know, those reoccurring blood draws where you go every quarter or whatever. Well, it used to be they would look it up. Last time I was in, which was just a week or so ago, they don't keep the sheet anymore, and you have to bring the sheet with you. I leave it in this plastic thing so that it's easy to find, because I always run around trying to find those darn sheets because it's 3 months later. Little tip. Medication interactions, that includes your supplements. You got to know what you're taking, including supplements and any possible interactions. If you have any concerns, you can go back and talk to your doctor about it, or you can shortcut it and go and talk to the pharmacist first. There's also Alberta has this PADIS 1-800 number, which that stands for, just flip here. Oh, darn, hang on. Am I on the right page? Yeah, okay. It stands for Poison and Drug Info in Alberta. That was painful for that, but anyway. Yeah, so, but I think unless you live in Alberta, you can't get there. There is one for webmd.com. That'll be on that list in the email. I don't think it includes supplements though. So read the sheets and like I say, always know your medications and what interactions are possible. And have a med list with you. So carry your med list with you when you're going to your doctors. Actually carry it all the time, frankly, but I also carry a list of toxic medications, because there's been more than once, especially if I'm out of town, where if you need, say, an antibiotic and they want to recommend something, you'll have to say, well, let's check this med list here, this toxic med list, because I'm not taking anything that's going to impact my neuropathy. We'll have to find something else. And that's what they've done. Even with my own doctor, I've done that. Okay, so you also want to have a history, your history of all of your conditions, any surgeries and dates and all the usual stuff. And you can search online to find samples. But what you want to do is take all of that information and compile it into what's called a wallet card. Really, it can just be a piece of paper written out, because frankly, they change all the time. I know my information changes a lot. So I just have a sheet of paper where I've written it out on the computer. Why is all that stuff important? Because it's always changing. So you really want to have the most up-to-date information, especially if you're going somewhere new and your doctor won't have that info. Continuity is also important. If you lose one practitioner, for example, say your physiotherapist retires, well, you don't want to have to start over from the beginning with a new one. If you have that information of what you've been doing, you can take that with you for your new one. It helps with timely diagnosis. So if you're organized, it can help move things along a little bit and makes new consultations, again, more efficient. In an emergency, having all that information can make a big difference, and it's even harder to think. And especially if you can't think for yourself or speak for yourself, I mean. And then there's, insurance, disability applications, work accommodations, having it all in one place just makes all that stuff a lot easier. Education. So assess and understand your own condition and how they are for you. So you want to understand it at a education kind of level, and then how does that impact me? How do all of these symptoms, which ones do I have? What have I been doing? All that kind of stuff. You can use the web to help you. Learn as much as you can, but please use credible sources. And if you're not sure how to do that, I'm going to include a link at some point. I'll discuss it. But the public library, the folks there can always help you as well. But if you understand your condition, you can set your expectations as well so that they're realistic. In the case of neuropathy, for example, don't expect a cure. It's pretty rare. And don't expect 100% relief, right? Diseases have their own vocabulary as well. So the one that popped into my mind when I was thinking about this was diabetes. They have their own language around the A1C. I still don't really, I know what it is, but don't fully understand it, but I don't have diabetes. Neuropathy definitely has its own vocabulary. You want to learn how to clearly describe your symptoms. It's really hard to sit down and think about our pain. It's still, if you do, it's a great way to advocate for yourself with your medical team. If you can provide a really detailed description, including all kinds of different points, like, that language of nerve pain tool that we have on the Neuropathy Association site is really good because we break it out into, I think, 5 different aspects of your pain that will help you describe it better, because describing it makes such a difference. Okay, learn what helps out there for you. There's medical, there's non-medical, there's help in the community, there's all kinds of stuff. And some of it's even free. Know what you're covered for. That's your insurance stuff. That way you can have an intelligent conversation with your practitioner if you're not covered for some things. So, and you remember Jean and Sally? Well, Jean found good, credible sources like us, and Sally didn't. So there's a difference right there. Why is educating yourself important? I just can't say it enough. Not all of us are good at thinking on our feet or remembering everything, but the more we know about something, the more comfortable and easier it is to talk about it, right? So confusion, you can help reduce confusion. Understanding your condition lets you come up with questions more easily and to understand the options and maybe even know what to expect. And just as important, to know what's not tied to your condition, your neuropathy. There's been many times I thought, oh, that's just my neuropathy, and discovered later that it wasn't. Learning types of practitioners. It's just better to discuss referrals if you know what's out there. When I first got diagnosed with CMT, nobody suggested that I see the neuromuscular clinic or see a physiatrist. I didn't even know what a physiatrist was at that time. So it's good to get to know that up front. And it helps you feel like you're taking control. That's another reason for educating yourself. You're taking control of your health, of your condition, doing everything you can for yourself, and you're really feeling empowered. You know, a doctor sees one of two things when you go in there. Either that you understand them and what you're facing or your condition, or that you've been misinformed. And either way, it's going to be a better discussion if you've tried to educate yourself. Keep in mind, just because you've educated yourself, because, you know, we are using Google here, it doesn't mean you're up to date. It doesn't mean you got it all right. And so you still have to keep an open mind when you're in there. But you do know yourself best and your symptoms. Okay. Medical professionals who can help. I probably should have called this just people who can help. But anyway, you do have to build a healthcare team. Now that team is going to, at least for me, it seems kind of disjointed at times, but not all of it's up to your doctor, because they don't go outside their system. So I have several medical people, but I also have a physiotherapist, I have a chiropractor, I have a Chinese medicine doctor. It's not all up to the doctor to coordinate everything. They just kind of stick to the medicine stuff. The types of health professionals who can help. Well, I've got a few samples here, a few examples, but there's really too many to list. And for that reason, I have in the email, I've actually built a document. It's just a Word document, but a page that, it's not a page, it's like 7 or 8 pages of different kinds of practitioners and people who can help. And I list them out and describe what each one does and what their role could be potentially. So that will be attached in that email as well. Okay, planning ahead. You know, we all know time's limited, right? We talked about that already. Louise, has there been any questions?
Sorry, no, they're not. Oh,
Okay.
yes. Okay, yes, one so far. Do you use acupuncture? This is Patsy who's asked the question just now. Question.
Okay. I do use an acupuncturist. The guy who's my Chinese, traditional Chinese medicine also does acupuncture. And so actually, so does my physiotherapist. He does dry needling. It's different. It's bigger needles, but yeah, so I do that. And does it help? I know that's the next question. Yes, temporarily it helps. And mostly it helps loosen the muscles that have gotten really tight because of the neuropathy. So for me, I use it. Yeah. Okay. So
Linda, Karen has made a very interesting, relevant comment about information sharing amongst practitioners. Now a lot of the information is available online. Yes, that's correct. My physiotherapist was recently able to see when I had all of my cortisone injections back as far as the spring of 21. You could also see all the information from my latest bone density. Yes. Yes, yeah. And the Alberta, the IT platforms, I think of, particularly of Alberta Health Service, now make it easier.
Yes,
to share info.
That's very true. Again, that's just the medical practitioner folks who are tied into the system, and only if they do it, because sometimes they don't.
Yeah.
Okay, so booking, because we know, you know, really only get enough time for 1, maybe 2 issues if you're lucky. If you have more than 2 items to discuss, maybe think about asking for back-to-back appointments. Or you could just book 2 appointments. Now, for some people, I know that's hard because you may be driving from a long ways out. So if that was me, I'd be pushy and ask for a back-to-back. And pushy is not an advocacy word, by the way. Anyway, track your yeah, go ahead.
Sorry, Linda. Rose would like you to go back one screen for a moment. I'm not quite sure, Rose, if you could, what exactly do you mean, one slide?
What's the question?
Could you go back one for a moment, one screen for a moment? Perhaps she means one slide. Perhaps you had links on there or something.
Yeah, there are no links on this.
Yes, that's what she would like. Yes, please.
I don't have links here. I don't have them here either. They'll all be coming in that email. Because you're registered, you'll get the email. I just have to send it at the end. Okay, so where did I get to? We're on planning ahead, right? Yes. Okay, so track your symptoms. So there's lots of different ways to do this. You can use journaling or a symptom tracker. We have some on our website, the number 47 for journaling and 61 talking about pain. There's actually a few trackers in there, but there's lots of other options, and there's apps, and there's all kinds of ways. But frankly, a piece of paper and a pen will do just as well. Identify a tool that works for you and start collecting your information. So if it's overwhelming though, because again, like I said, nobody wants to sit down and think about their pain all the time, maybe just do it in the weeks or week before your appointment, or ask somebody to help you with it if it's too much for you. Make your list and include concerns and symptoms, timing, intensity, that language of nerve pain helps walk you through that, I hope, and triggers. Yeah, so practice. I know it sounds funny, but practice communicating it out loud, because it really is not the same as doing it in your head. It's different when you have to look people in the eye. I have a problem looking people in the eye when I'm talking to them, and it's taken me years of practice to be able to do it. And if you don't have anybody available, do it in a mirror. That can actually be very telling as well. Controlling emotions can be hard. Sylvia reminded me of this. Thanks, Sylvia. Strong emotional responses are part of the chronic pain cycle. So practicing techniques to control your emotions may do you some good service. Why? Because you don't want to be blown off because you're emotional. It distracts from what you're saying and what you need. If you're upset or angry, people are going to be focused on, why is she responding like that? Holy cow. Or if you're ruminating or repeating yourself, kind of incoherent, disjointed, and you're just not getting your message across, plain and simple. How? Well, the only ways I know is practicing meditation. It doesn't have to be a lot. Doing it fairly regularly is best, but it really helps with emotional regulation, and it does it pretty quickly, like within weeks. Learn breathing exercises that help calm the nervous system. 4 breaths or 4 count in, 6 count out, something like that. If you learn those breathing techniques, there's so many of them. They really help you calm your nervous system if you're feeling that under pressure or put on the spot, like Sally was. Why it's important? It's hard to remember everything, and you don't want to miss anything that's important. And when you practice out loud, you actually will come up with more questions. I always do. Practice that, again, that saying, it sounds better in my head. It sounds so different when you say it out loud. And practice with somebody, hopefully somebody that you trust. Are you repeating? Are you clear? And you're going to get feedback from that person that you're practicing with, hopefully, if it's somebody who's a good advocate. And out loud, also, verbalizing helps to reinforce learning. You can better evaluate how you sound. And in the end, you're going to be less anxious for the real thing because it helps to build confidence. And so it's just a really good way to do it. You better believe I practice this thing out loud over and over again. Okay, appointments. This is about, you've kind of noticed it's about a doctor or specialist appointment, but you can really extrapolate this for any kind of medical practitioner or any other use. But remember, we want to pick and choose what applies to you, right? So you're going to arrive early, give yourself enough time just to review your list and your priorities and think about what you were going to say for each. I'll sometimes do this in the car before I actually even go in. Your prioritized list, describe things just as you have practiced. But if you have a list and you've got, say, 5 things on your list, and you know you're only going to get to 2, maybe give them the doctor the list beforehand so that they can give it a quick look over, because there may be something that they look on that list and go, oh, wait a minute, this is really important. We got to talk about this first. Just a thought. And if you're specifically asking for something, sorry, like a prescription or a test or a referral, prepare to explain why you need it. Explain the help you're looking for. Like, what do you want from it? Because they're going to ask. And if you're not sure that they'll be comfortable, maybe you bring a research study that supports what you're asking and why you're asking it. Take notes, situation dependent, but include the date, the names of everybody you meet that day, include their role. So all of this is so you can help you understand who to speak to if you have any specific questions after the fact or any concerns. If you think it's going to be hard, sorry, I ate dairy yesterday, and this is what happened. Yeah, I guess I'm just going to have to muddle through. Okay, so take notes. If it's going to be a hard appointment, ask if you can record it. Like if you've got brain fog or you're feeling really stressed or really worried, ask if you can record the appointment. I used to do that with appointments for my dad, even though I was there to listen. And then take those notes or the recording and update your binder when you get back home. Just a reminder there. It's always a good idea to confirm the next steps before you leave. What are you doing for time? Because, sorry, I'm just having a brain fart. You know who's doing what, but most importantly, it's if you're confirming, you can bring to light anything that got forgotten or questions that you didn't write down. Okay. So why is it important? Again, you're taking control. And so you're feeling empowered. You're clearly communicating. And so you are getting what you need or hope for. And you'll think of extra questions to ask. And of course, sometimes it just becomes a discussion. And make sure that you're both up to date and you're on the same page. Again, reducing confusion. Jean did. Sally didn't. Easier load. I'm just going to go through this quick. Pacing, we all know, hopefully, is really important. So if you can find little ways to ease your load, like going for phone appointments instead of having to go in for things like refills or whatever, ask them to give you things in writing if you can't focus well enough, or you can't spell it. That's happened to me. Or let them know somebody's going to be coming with you. And facts, rather than if it's hard for you to move around, have them fax the prescriptions over to your pharmacy. At pharmacy, you can do the blister packs, so you're not having to think every day about what pill, when, what time, and all that kind of stuff. In Alberta, actually, you can totally avoid some appointments. I did this actually a couple of weeks ago by asking the pharmacist to prescribe. It's limited what they can do. And I don't know if you can do it down in the States or in every province, but here you can get the pharmacist to do some of that. You can also ask or find a pharmacy that delivers. So switch pharmacies to one that delivers. Ask a friend to pick it up for you. That just means you're going to have a credit card on file, but that's fine. And then again, always remember to update your sheet in your binder. Okay, so you have been clear. You prepared ahead. You gathered all your thoughts, but for some reason you're still not happy. So this is a two-way conversation. And both parties are trying to come to an agreement, right, on what's going to be best going forward for you. So if that's the case, it's time to go to the next level, I guess. If you're frustrated, take a breath, even if it's just to say, I've got this. Take that breath, look them straight in the eye, calm and polite, and ask for what you need. Just so you know, I have 4 additional slides in this slide deck at the very end that are just sample questions that you can, sometimes they just stir ideas, right? Appearing confident can be as simple as sitting up straight, maintaining eye contact, and speaking with a clear and steady voice, preferably without a tic-tac in your mouth. Anyway, okay. So I talked about credible websites. If you're going to refer in your discussion to something that you found online, bring it with you, and only bring one. Like, don't bring a stack of stuff. Bring the best one. And they may still just blow you off, and that's a whole different problem. But learn to identify credible sources. I keep talking about that, and I'll harp about that forevermore. The video and this link on how to do that will be in that email. When I've done this a couple of times, and I bring something with me, I say something like, depends on the situation, I understand research can be contradicting, but I brought this page from a systematic review that looked at blah, right? And fortunately, my doctor is receptive to that. So, like I said, the links will be in the slide. It's very important, if you have to stand up for yourself, to be assertive and not aggressive. Advocating doesn't mean being confrontational, although sometimes we might want to be, or aggressive. Being firm, respectful tone, avoid raising your voice, avoid using hostile or foul language. Take a breath before speaking, even if it's just a growl. And then organize your thoughts. I don't think you ever have time to organize your thoughts, but you do have time to growl. In your head, by the way. Active listening. Pay attention to the other person's perspective and actively listen to their responses and their questions. And by the way, ask questions about their questions. My experience is that people don't always hear the question that was intended. So, can you describe what you feel when the pain flares up? Our Sally response and our Jean response. Did I mix the two of them up? No, anyway. It's quite different. It can be, all you need is a clarifying question. This is my point. Just don't jump to an answer. Think about the question for even half a second. Using I statements. I statements to take ownership of your thoughts. They allow you to take ownership of your thoughts and feelings. For example, I believe or I need, rather than making accusatory statements. I need to understand better. Can you explain it? I didn't follow that. Can you explain it again? And then finally, if it's important enough, you need to push for extra time or another appointment that's going to come in a timely fashion, right? So being assertive and not aggressive. Sally came in with her article from Google, or she found one on art. I don't think she brought it with her, and it got her nowhere. So, and actually, I've had this where you get a lecture on research studies. Whereas Jean, she wanted her test. She came in prepared to support it and said it was from Stanford and backed up her thinking. Google is a great resource tool, don't get me wrong, but it's important to find accurate and up-to-date information, or you just, yeah, get blown off. All questions are good. Approach, if you're going to ask questions, approach with a curiosity. A curiosity mind state, actually, it's been shown to calm down the nervous system. And by going through things like I'm going to talk about, you identify what you know and what you don't know. And based on that, what do you want to know? The language, use language that's cooperative. There's definitely a difference. And not competitive. Help me understand. I could use more information. Open-ended questions are known to be more cooperative. So a closed closed-ended question is something where you're only going to get a yes or no answer back. Is that all I need to know about medication? Yeah. Or open, can you tell me more about the side effects, how well it works, different medications, for example, right? And another thing you can do is start with less, if you think it's going to be controversial at all, start with a less sensitive question, and then build up to the more sensitive stuff. So, have you had other patients with the same condition or presentation? Might be one question. Is much better than saying, do you have much experience with this? It's, same question, but do you know someone with more experience? Can I refer to them? Is sort of the way I would round that out. Just as an interesting exercise, I plan on doing this myself. Try to listen to people in general. It doesn't have to be a practitioner, and listen for the closed versus open-ended questions, and see what you can learn from that. Okay. Oh, and then at the end of an appointment, do the mental check at the end. Did you get what you needed? Analyze the goal that you had. Did you get it? Some cases, you may need somebody to come with you. I feel like I got, okay, sorry. The qualities in an advocate. So if you need somebody to come with you, you don't want to just grab, Cousin Joe, because maybe Cousin Joe doesn't know anything about what you're going through. But so look for somebody who's informed, and obviously somebody with a medical background is preferred, but if not, that's fine. Somebody who's well-spoken and can understand. You have to be comfortable talking to them, because you're going to have conversations before the appointments, you're going to have conversations after. Are they able to take notes? Do you trust them? And can they help you find resources? Having two people there to hear the discussion is way better than having one. It's hard to listen if you're the person, even for me, and I'm used to doing it. It's hard to listen and take notes and think of questions and do all of that at the same time, especially if you're under stress, right? I would record and play back to my dad. I always asked if I could record because sometimes we would disagree on what was said. And if I could play back that recording, it was, there was no denying it, right? Advocate, a good advocate is somebody who doesn't speak more than the patient. Now, that's not always possible. It's always better to hear from the patient, but especially with older folks, sometimes they go on and waste a lot of time on stuff that is not important or not even relevant. So this is our gal Jean when she got older. Who especially benefits? The older folks from having an advocate come with them, and people in pain too, because of the brain fog, or anyone with a chronic condition that experiences brain fog. Having an advocate is not just about somebody to come along for your doctor's visit. An advocate can actually watch and observe you and tell if the treatment is working or not. They're more objective, right? An advocate can speak for you, of course, when you're struggling. They can help you find resources. They'll help you go through. They'll help you beforehand and build your list. They'll help you keep your binder up to date, all that kind of stuff. Now, there are patient advocacy offices. They do seem to me, from what I could find, more about providing a space for complaints and managing complaints. I did find one company down in the States called Patient Navigator that looked really good. And actually, I based some of the content in here on that discussion, on that podcast. I'll try and add that to the list anyway. And then always follow up. So never assume that things are going to happen like they're expected. Our system is our system, and there are cracks sometimes. And actually the folks at Patient Navigator, she used this example that the system, so it's the same in the States. The system uses 80 technology, i.e. faxing, and faxers can get lost. Faxers can fall behind the machine. Faxers can get thrown out. So always follow up. I know we've had problems in the past with my dad over the years. I mean, not that regular, but my dad's and my husband's mom. Things sometimes just do. So just make sure things are getting done and follow up. A good question. To ask your doctor, if I haven't heard back by, when should I follow up with you, with whoever, right? I think you always follow up back with your own doctor. And medical gaslighting. This is a term, I don't know where it came from specifically. I can't remember, but I think there was a New York Times article beginning of this year or maybe end of last year. And it was a very one-sided kind of article. So this doctor at Strong Medicine decided he needed to address some of the medical gaslighting stuff. And so that's what this is based on, because frankly, I've never actually experienced it myself. So medical gaslighting is the experience of a patient in which a medical professional discounts their concern. So true gaslighting implies that they're actually lying to you and they're trying to get you to second guess yourself. And according to the folks at Strong Medicine, this is a very rare thing, and I kind of believe it. Maybe not as rare as he was thinking, but it's definitely not the same though as disagreeing with what you're thinking. So if you get frustrated, you may get frustrated with each other and not agree. But it's much more likely that other factors are causing the misalignment or misunderstanding. That the doctor might have an explicit bias. They could be responding to somehow to what your behavior is, who knows? Or something maybe happened earlier in the day they don't always have thick skin. They can't always have thick skin. And they don't honestly get a lot of training for this, to handle these kinds of difficult situations if there's a whole lot of tension. So it does happen, but not that often. And just be aware of it. And I would suggest using something like what our gal Jean did. Let's hit the pause button. I feel like we have a disconnect, of course, straight in the eye. But I need you to hear what I'm saying. And let me start again. And according to the folks at Strong Medicine, sometimes just being called out like that is enough for them to go, oh, okay. So how are we doing for time? Oh, over. Summary, organize your medical history and your lists, educate yourself, plan so you know what you're doing, prepare and be practiced so you're confident, appointments, be confident and assertive, and follow up. Okay, there's a bunch of references. There's my thanks, and then sample questions. Buzz. You get them as soon as I send this out. Okay, let me get out of here.